Let me ask you a serious question. A patient receives the correct medicine, but the prescription was wrong. What happens? Overdose, drug interaction, serious adverse reaction. That's why NABH focuses strongly on MOM.4, safe or rational prescription. Because prescribing is the first clinical decision that directly affects patient safety. Hello everyone, I am your NABH guide. Today's session is extremely important because 70 to 80% of medication errors start at prescribing stage. In this session, we will cover all objective elements of MOM.4, practical implementation, real audit expectations, common non-conformities, how to ensure full compliance. Let's begin. Rational prescription practice. First, understand one key concept. What is rational prescription? As per WHO, right drug, right dose, right duration, lowest cost, as per patient need, hospital responsibility. Train doctors on rational prescribing, follow medical ethics guidelines, apply to both OPD or IPD. Overprescription and irrational use means increased cost, increased resistance, increased patient harm. Minimum prescription requirements. A prescription is a legal document. It must be complete, clear, and error-free. Mandatory elements: patient name, UHID, hospital number, drug name, generic mandatory, strength, dose, frequency, duration, total quantity, doctor name, signature, registration number. Critical rules: no error-prone abbreviations, write in capital letters, prefer digital prescriptions. Error correction: single line strike, rewrite clearly, sign, initial. Assesses randomly pick prescriptions and check all these points. Allergy or ADR check. Before prescribing any drug, ask one question: does the patient have any drug allergy? Requirement: check drug allergies, check previous ADR. Documentation must be clearly documented, highlight in case sheet. Missing allergy documentation means serious patient safety risk. Decision support system. Doctors are human, errors can happen, so systems should support them. Mechanisms include drug interaction checker, food drug interaction alerts, dose adjustment guidance, duplication alerts, format, software, HIS, printed guidelines. Medication reconciliation. This is one of the most important and most ignored processes. What is medication reconciliation? Matching previous medications with current prescription. When required, admission, transfer between departments, discharge, after cross-consultation. Requirement: must be documented, must be communicated during handover. Many medication errors happen during transitions. Verbal orders. Verbal orders are risky, but sometimes unavoidable. Rules: only in emergency, limited use. SOP must define who can give order, when allowed, which drugs allowed, safety practice. Read back, repeat back. Mandatory: doctor must countersign within 24 hours. Uncontrolled verbal orders, major NC. Prescription audit. You cannot improve what you don't measure. Audit must check legibility, use of capitals, drug appropriateness, dose, route, frequency, drug interactions, duplication, food drug interaction, renal hepatic dose adjustment, IV compatibility, frequency, at least once a month. Who should do? Clinical pharmacist or trained committee. Best practice: live audit before dispensing. CAPA, corrective or preventive action. Audit without action, waste. Requirement: root cause analysis, RCA, corrective actions, preventive actions, documentation, CAPA records maintained. Assessors always ask, what action did you take after audit? Common non-conformities. Incomplete prescriptions, use of abbreviations, no allergy documentation, no medication reconciliation, verbal orders without SOP, no audit system, audit done but no CAPA, poor documentation, doctors not trained. How to comply? Step 1. Standard prescription format. Printed or digital. Mandatory fields. Step 2. Doctor training. Rational prescription, error prevention. Step 3. Allergy system. Mandatory documentation, highlight in file. Step 4. Reconciliation process. Define SOP, train staff. Step 5. Verbal order control. SOP, read back. Countersign. Step 6. Audit system. Monthly audit, defined checklist. Step 7. CAPA implementation. RCA, action tracking. Final summary. MOM.4 is the starting point of medication safety. Safe prescription, rational use, strong monitoring means Safe patient outcomes. If you are preparing for NABH, focus strongly on prescribing practices, because this is where most errors begin. Remember, the safest drug is not the most expensive one, it is the one that is prescribed correctly. In the next video of this NABH training series, we will discuss uniform medication orders. If you want to learn NABH standard step by step, then video को like करें, channel को subscribe करें, notification bell on करें, so you never miss upcoming NABH training videos. Medi Quality Partners, your trusted NABH guide. Thank you for watching.